Hello and welcome to Better Health. Today we are going to cover a surprising treatment for knee pain. If you've ever struggled like I did with knee pain so bad that getting up off the floor was difficult without help, then this video is for you. In today's video, I'll share how L-glutamine changed my life, and explore what current research says about its potential for joint relief. Stay tuned, especially at key marks. I'll drop special scientific nuggets and tips you don't want to miss. This year my knee pain got so bad I literally needed help just to get up off the floor. It was painful just kneeling on the floor. I had to stop using the elliptical and treadmill in the gym, because it would aggravate my knee. It was frustrating and discouraging. I'm now in my 70s and I want to in shape and be active. I tried braces, ice, heat, specific exercises for the knee and kneecap, but nothing gave me consistent relief. Knee x-rays were normal, and I had good alignment of my knee joint.
So, what was the diagnosis? Basically, it was what is commonly called runner's knee, when the patella or kneecap doesn't glide smoothly in the knee joint, usually due to weak inner thigh or adductor muscles that cause the patella to be pulled more to one side, or out of alignment. You start to hear and feel a lot of grinding and clicking when flexing the knee. Over time, the smooth underside cartilage of the kneecap begins to wear down, becoming rough and thin. This leads to a condition known as chondromalacia, along with inflammation and pain.
Doing some research, I stumbled across some preliminary evidence on glutamine, amino acids, and joint health, and I decided to try 5 grams of plain L-glutamine daily. Just 1 week in, I suddenly noticed I no longer needed help getting up off the floor. Within 2 weeks, my pain had dropped dramatically. Today, I hop on the elliptical at the gym, zero knee pain. If this is you, struggling with stiffness, soreness, or joint grinding, this story might be relevant to you.
If you've tried everything for your knee pain and it still hurts when you bend, then listen up. In this next section I will dive into the mechanisms and how L-glutamine is believed to help support the knee. First, what is L-glutamine? It's the most abundant non-essential amino acid in the body, meaning your body can make it, but in times of physical stress, injury, or inflammation, the demands for glutamine rises, and it often rises more than the body can supply. Glutamine supports our immune cells, our intestinal gut lining, our antioxidant systems, and to help balance our metabolic system. Many sports nutrition protocols already use glutamine for recovery and reducing systemic damage to the musculoskeletal system. But how might it help knees specifically? Let's walk through 3 plausible pathways that research has revealed. First up is anti-inflammation and immunomodulation. Numerous animal and cell models show that glutamine can suppress pro-inflammatory cytokine molecules, especially during mechanical stress. It also supports the immune system for healing. Next is cartilage protection. In osteoarthritis models, oral L-glutamine reduced cartilage degeneration. Another study found that glutamine can inhibit certain enzymes in joint tissues that degenerate joint tissues. And number 3 is muscle support. Strong muscles around the knee help offload joint stress. One trial in older adults found that L-glutamine supplementation improved knee muscle strength and power when combined with exercise. So, it's not a miracle cure, but it is a good supporting actor.
Let's pause for a second. If you're skeptical, that's good. Always ask, does the evidence hold up? Also, my knee alignment between the femur and tibia is pretty good. That is not the case for hundreds of patients I have x-rayed, especially if they were very overweight. So I may not be typical. And let's be honest, the human data on L-glutamine specifically for knee joint pain is limited. Most evidence is preclinical or small trials involving muscle recovery and not specifically joint degeneration. I have added some links to some supporting research papers to those of you who want to go deeper.
Research reveals that safety is generally good at moderate doses of 5 to 10 grams per day in healthy people. Some studies even found that 20 to 30 grams per day was well tolerated, but there is a caution with those with cancer, liver disease, kidney concerns, or certain metabolic conditions, should proceed carefully and consult their doctor first. So, you can use glutamine as a possible adjunct, not a total replacement for proper care, exercise, or medical oversight. Still here? Good. Now let me walk you through exactly how I used it, and practical steps if you want to experiment safely. Here's how I implemented taking glutamine. My dosage was 5 grams of plain L-glutamine powder daily. I usually add it to my morning juice or smoothie. At times, even in my morning coffee. Duration. After 1 week, I notice a big improvement when I got up off the floor without needed any help. I now split my 5 grams and take half in the morning and half at night. Supportive habits. I kept up my low-impact resistance training, weightlifting, and light cardio. Monitoring. I noted minimal bowel changes the first 2 days, nothing serious, just more frequent urges to go but didn't have to go. Cycle or pause. After 8 to 12 weeks, I will drop to a maintenance dose or pause, then reassess its benefit. But so far it's working.
If this is you, with persistent achy knees, you may benefit from a trial using glutamine. In the last minute, I'll recap key takeaways, so you can decide if L-glutamine might make sense, or be a waste of your time.
Here are the key takeaways. My personal experience. A 5 grams daily glutamine protocol led to dramatic relief within a week. I no longer needed help standing up, and now I train pain-free on the elliptical. Mechanistically, glutamine may reduce inflammation, protect cartilage, and support muscles around the joint. The evidence is preliminary, so use it as an adjunct, not a standalone cure. And always consult your healthcare provider, especially if you have cancer, kidney, liver, or metabolic conditions.
If you try glutamine, then monitor your pain, your mobility, any side effects. After 12 weeks, consider a stop period for a week or two to test its true effect. If the pain or restriction returns, then you know it helped.
Thanks for watching my video. If you found it helpful, then help us out by hitting the like button and subscribe for more health tips. While you are here, click on the link above to see the next recommended health video. So until next time, take care.